As I look through the program, I see researchers from social work, psychology, nursing, law, neurobiology, pharmacology, toxicology, neurology, mathematics, philosophy, oncology, psychiatry, music. The breadth of the research that happens with that collection of disciplines is really just so powerful. And of course, that's one of the great advantages of having this integrated campus that we have.
75% of undergraduate students report emotional or mental difficulty impaired their academic performance at least once in the last 4 weeks. That's the measure that is used. That's down from 83%. But when you think about us talking about as a university, and all universities, that student success is our North Star, we have to be concerned with how do we support our students as a living lab, our employees and our staff who support those students in their mental health, so that we contribute to the development of successful students who become successful employees later.
I'm thrilled to be able to talk with you about our third annual mental health grade and behavioral sciences research. What we're doing here is unique because what we're doing is bringing together the entire strength of the University of Utah to deal with the challenges we face with complex problems. Like, why is it that 75% of mental disorders begin between the ages of 10 and 24? Why is it that mental disorders and substance use disorders are the greatest cause of disability in the world? The only way we're going to answer these questions is by bringing together viewpoints from a host of different perspectives. And that's what we're doing at the University of Utah, and no one in the world is doing it.
Today I talked about how important it is to have regular routines in our lives. Regular wake times, regular meal times, regular times when we engage with other people. So friends, family, and so on. Here's why that's important. We've learned that these regular routines are really important for our mental health and our general health. So working toward regular routines can be a goal of everyone's daily life.
Today I talked about a new technology called behavioral artificial intelligence and how we're going to be able to deploy that through smartphones to improve care for mental health at massive scale, both in Utah and even at national and global levels. The way it works is that patients perform an assessment on their phone that's videotaped, and then that information is analyzed by computers, and it helps to understand what the patient's suffering from and helps to inform the doctor about the best approach to treatment.
Today, what I talked about was risk stratification in mental illness and in substance use. And so what's risk stratification? It's starting to develop ways to tell whether people might be at risk for a mental illness or might be at risk for a substance use disorder before those things actually happen. In other words, before they're sick, before they're patients. This is something we don't have very well developed in mental health. This is the biggest thing we need to actually be able to start a culture of what's called primary and secondary prevention in mental illness in order to move people towards a place of wellness, of resilience, and not waiting till they get sick to introduce some interventions and ways to help them stay healthy.
Today I had the pleasure of talking about implementing artificial intelligence in psychiatry, some of the considerations that we need to keep in mind. Most importantly, I would say we absolutely need to make sure that these important advances are both safe and effective for the patients that we're caring for. Only with that type of oversight can these tools realize the potential of helping millions of people around the world.
Today I gave a talk about how we're using a tropical fish called a zebrafish to assess the way that drugs that we are all exposed to impact our behaviors. And this tropical fish allows us in a remarkable way, combined with AI, to understand at a deeper level than we've been able to before how common drugs change our behaviors and change the function of our brains.
Today I talked about the research doing in the lab. So we're interested to know what happens when an immune system gets activated and cells from the peripheral immune system gets into the brain, how those can drive the activation of neurons and the development of epilepsy. So although I'm focusing more on epilepsy research, activation of the immune response has been shown to play a role in many other psychiatric disorders and brain illness. So it's pretty relevant to the mental health community.
Today, I talked about changes in brain volume in military service members who had a history of blast-related TBI and potential cognitive implications for that. This is important knowledge for the community because it will be critical for our continuing support for our service members and hopefully identifying new targets for cognitive rehabilitation and perhaps having some implications for policy moving forward.
Today I talked about how we capture real-world memories as people walk around in the real world and also do brain recordings from deep places in their brain where memories are made, like the hippocampus. This is really important for our community because we're trying to figure out how these memories are made and what happens when those memories have some difficulty being made in people that have psychiatric diseases and things like Alzheimer's and traumatic brain injury.
Today I talked about the history of sterilization in our state and how it relates to the ongoing practice of sterilizing people with disabilities without their consent. I think it's important to be aware of that history because it shaped the program that exists today. And it turns out that it's very controversial to sterilize people with disabilities without their consent. And so what I hope to convey was that we need to be familiar with that history if we want to have a better understanding for what's going on there and a better ability to evaluate what's so controversial about it.
Today I talked about current ethical issues in psychiatry. I raised a couple of different questions about some hot-button issues in psychiatric ethics, including medically aided dying, palliative psychiatry, and some ethical problems with suicide prevention. I think these are important for the general public, largely because psychiatric care impacts everybody that we know, or at least has the potential to do so. And because although we're developing new tools to treat psychiatric illness, we don't always know what the best way to implement those tools is, and that's something I'm interested in exploring.
Today, I spoke about developing a faculty practice model that allows us to serve rural Utahns through novel contracts between the University of Utah and these rural community mental health centers.
Today, I talked about a pilot study I have going on that is investigating some of the change mechanisms at play for effects of wellness and health in performing arts activities. We have a pretty good idea that these are already beneficial to us, but we don't know exactly what the processes are, and we need to improve our ability to prescribe them and to be able to sort of maximize the benefit.
Today, I spoke as well as Lynn with the pilot research that we're collaborating on, and also that this is part of a wider international research working group that is exploring mechanisms of change and integration of team science as it responds to the psychophysiological, psychological, the musical, the creative mechanisms that change when we engage in arts-based interventions in society, spaces, as well as in clinical spaces.
The great work happens not in the discipline, but it happens at the interfaces of the disciplines. And that is exactly what the Huntsman Mental Health Institute, its leaders and its members have done.